Assalamu alaikum and welcome to another episode of Doctor in the House. I am your host for today, Dr. Tawfiq Hussein. And as I previously mentioned, I am a family medicine physician. I graduated my MBBS degree in 2019 when I proceeded to complete my internship at San Fernando General Hospital. I completed right when the pandemic started, and then I worked in different departments such as accident and emergency. Then I went to anesthetics and ICU, general surgery, and then internal medicine. I then went on to find my true passion and calling in primary care and family medicine. Today I am joined by one of my close and dear friends, Dr. Azim Nabi. Dr. Nabi, like myself, graduated in 2019 with an MBBS degree with honors. He went on to work during the COVID-19 pandemic to take care of some of the sickest patients through a dark time in our history. Dr. Nabi is a member of the Royal College of Physicians, a very prestigious college, and he got this honor by completing his exams. Assalamu alaikum, Azim, and welcome to Doctor in the House.
Wa alaikum salam, Tawfiq. I appreciate being here. Thanks for having me.
Okay. So, Azim, today we will be discussing a very important topic, a topic which may have been discussed many times in the past and a lot of patients may think that they know a lot about. This topic is a topic that affects every single person in Trinidad because I can guarantee you at least one member in your family, and if not someone in your family, somebody that you know is suffering from this disease, whether it be your grandmother, your mother, your father, your parents, your siblings, your neighbor, whoever it is, you must know somebody in Trinidad and Tobago who suffers from diabetes. Azim, tell us a bit about your thoughts on this disease.
Definitely. So, diabetes, such a common chronic disease here in Trinidad, especially, when working in internal medicine where I used to work. Most patients, they would actually come in for other problems, whether it be heart attack, whether it be stroke, whether it be kidney failure. And surprisingly enough, when taking information from these patients, when they now come in, almost all of the times, diabetes would be a part of their comorbidities. So it just goes to show how much this particular chronic disease contributes to other diseases in the human body. Yeah.
Very good. So, Dr. Nabi, we hear a lot about diabetes, and in Trinidad, in our local terms, you might hear people refer to it as sugar, right? So maybe it has something to do with sugar, right? So we want to ask you the question, what is diabetes?
Right, absolutely. So diabetes, simply put, is a chronic disease, chronic means long-term, in which the level of sugar, or glucose, we call it in the blood, is too high. And the problem with this is that high sugar in the blood over a lengthy period of time can lead to disease. And we'll discuss a little bit more about that later. So usually what happens is you eat food and the pancreas in our body produces insulin. When that food is digesting, it becomes sent to the intestines, and then the sugar is absorbed into the blood. This response prompts the release of insulin from the pancreas. Now, what this insulin is supposed to do is actually take the sugar from the blood and place it into our cells, our tissues, our muscle, the liver, right? Effectively removing the sugar from the blood for our cells to use as energy and to store some for later. What happens in diabetes in the two major cases is that either the body doesn't produce the insulin at all, or the body produces the insulin. However, the insulin is not effective in taking the sugar out of the blood and putting it into the cells and the tissues. Thus, the sugar remains in the blood. That's where we get the term high blood sugar, or our colloquial term, just sugar, right? So that's generally what the basis of this entire disease.
All right. Thanks for that very comprehensive definition so that the viewers out there can understand exactly what diabetes is. Because some people, this is a disease that has a lot of misconception, right? So we finally clean up some of these for the people out there so that they could truly understand, well, what is diabetes? If they want to explain to the neighbor, well, I've gone to the health center, the doctor tells me I have diabetes, neighbor say, well, what is that? So now, with your explanation, they understand and they can explain to the others what it is. So, Dr. Nabi, diabetes, there are different types, right? So let's go a bit into the different types of diabetes. 1, 2, 3, 4, how much it have? Let's hear a bit about that.
Of course. So to start with, the most common types we have here in Trinidad is type 1 and type 2 diabetes. However, there are many other types of diabetes. A lot of you might know as well that in pregnancy, there is a type of diabetes, which is a temporary type of diabetes called gestational diabetes. There's also a genetic diabetes called maturity onset diabetes in the young, and a few more. But the majority of cases here in Trinidad, as well as worldwide, is type 1 and type 2. So let's talk a little bit about that. So as mentioned before, type 1 diabetes, this particular diabetes, the body does not produce insulin at all. And it is commonly seen in our younger population. So in the pediatric endocrine department, in the outpatient clinics, etc., these clinics will deal with our kids or young adults who have diabetes type 1 or other types, but it's more common in type 1. And type 2 diabetes, this is where the body produces insulin. However, the insulin is not effective. The body has insulin resistance. Therefore, in either of these cases, the sugar in the blood remains quite high. Yeah. The important thing to note about type 2 diabetes is that it is actually strongly linked to lifestyle factors. So, as we would see a little bit later, it's linked to weight gain, obesity, it's linked to lack of exercise, a big one being diet, as well as genetics. Yeah.
So a good definition, and then we went on to classify the different types of diabetes. So as you mentioned, in simple terms, type 1 diabetes is diabetes that would be onset and start when you are a child, when you are a kid, right? Sometimes you might even hear it referred to as juvenile diabetes because children get this and it lasts the whole life for them because their pancreas does not produce any insulin. So their only source of insulin is from what is being given to them. Then we spoke about type 2 diabetes, which is the most common one that we experience as a lifestyle disease. As you mentioned, some of the risk factors such as obesity, lack of exercise, poor diet, right? Basically all to do with the lifestyle that we might be living, right? And there are other subtypes that aren't as common, but they are out there. Gestational diabetes, as you mentioned, it is where a woman would develop diabetes only during the pregnancy. However, important note is that these patients are at higher risk to develop type 2 diabetes later on in their life. So, although you have gestational diabetes when you're young and it may go away when you are not pregnant, you have to be aware that you have to take steps to prevent yourself and to screen yourself to ensure that you do not develop type 2 diabetes. So, Azim, with all of this in mind, we'll go to our first commercial break, and when we return, we would want to talk about how do you know you have diabetes, what are some of the symptoms, what to look out for, and when to test, and we'll go into some of the other details like this. So when we come back, we'll continue our discussion on diabetes.
Win one of 100 shopping sprees. Super Mom, Super Dad, Super Wins sweepstakes is here at Possard's the Food King and Bright Ideas. This is your chance to shop, enter, and win weekly. Here's how you can win. Every time you spend $300, you get an entry form for your chance to win one of 100 shopping sprees. Plus, every Saturday during our live draws, you can shop, spin, and win instantly at any Possard's the Food King. Hurry! Promotion ends June 24th and is NLCB approved.
Possard, quality value, that's our way. The real Possard's, we're here to stay. The Food King Possard's.
نغلط ونقول بكرة نتوب وبكرة منتوب نلقى نفسي ضعيف نرجع.
Never too early, never too late to recharge and hydrate. Get your daily dose the right way. Grab an Oasis, now why wait? Never too early, never too late to recharge and hydrate. Get your daily dose the right way. Grab an Oasis, now why wait? The greatest, the safest, Oasis for sure. Oasis, it's purer than pure.
Assalamu alaikum and welcome back. So we continue our discussion on diabetes. So as mentioned before, before we went to the break, we want to know, how do you know you have diabetes, right? What are some of the symptoms? You know, what would the patient, what would the individual experience, and when they have diabetes, how to know, how to check, when to check. So Dr. Nabi, just give us a little light on this.
Of course. So the interesting thing about diabetes is that a lot of people have it and they walk around not knowing that they have it. In fact, a lot of times in the hospitals, an elderly patient would come in, most times, if sometimes, with a cut on their feet. And they said, "Doc, this cut is not healing." And interestingly enough, what they also say is, "Doc, I didn't even know that I got cut on my feet." Or, "Doc, I didn't know that I had a pebble in my shoe." And we check the blood sugar, and it turns out that they have been an uncontrolled diabetic for years, maybe over 10, 20 years. And they didn't think to screen, or they didn't develop any symptoms. And so that's why it is so important to be educated on this topic. So let's talk a little bit about, when do we screen, right? So it's recommended that if you're over 35, that you get screened for diabetes. And we'll talk a little bit about how to do that. Or you can get screened younger if there is risk factors such as obesity, hypertension, or if you have a very strong family history of diabetes. So how do we test for this? So there are three main things. So the first thing we can do is fasting blood sugar. So if you have symptoms of diabetes, and these usually manifest itself as excessive thirst, frequent urination, blurry vision, fatigue, weight loss, slow wound healing, right? These aren't specific to diabetes, but definitely you should get tested if you have been experiencing these symptoms. So first of all, a fasting blood glucose. So this is that you go to sleep, you fast the entire night, and you wake up, and the first thing you do in the morning is check your blood sugar, right? You can buy a little blood sugar machine and check your blood sugar. This, the reading should be less than 110 milligram per deciliter, right? If you're less than 110, this is good. If, however, you are 110 to 125, this means that there is some insulin resistance, what we like to term pre-diabetic, right? And then if you are 126 and onwards, that suggests that you are diabetic and that you should come in for management and further testing, right? The next thing that we should do is something called an HbA1c. HbA1c is a bunch of letters that mean glycosylated hemoglobin, basically the sugar in the blood on the red cells. And this particular test is very important. The reason why is because it tells us your diabetic control over the past 3 months. So the interesting thing about this particular test is that we sort of use it to see if patients are compliant with their diabetic medicine. So a lot of times in clinic, we've seen that a patient, they may not be taking their medicine regularly, or they may be negligent in taking their medication on time. But they know that they have to come to the clinic in the morning, so they take it. So the blood sugar reads good when they come in the clinic. However, when we check the HbA1c on the blood test, we've realized that it's quite off, and their control hasn't been good over the past 3 months. So this particular test is usually given as a percentage in most labs in Trinidad. Every lab will have its different reference ranges. However, we could use this as a rough guide. So you would like the HbA1c to be less than 5.8%. And if, just like the fasting blood sugar, if it's between 5.9 and 6.3, that will likely suggest you have some prediabetes or some insulin resistance, but likely not full-blown diabetes yet. And then 6.3 and up is confirmed diabetes. So these are the two important tests to use to diagnose it. Another test there is the random blood sugar. Now, this particular test, we actually have patients test their blood sugars different to keep a blood sugar diary. This is very, very important for your blood sugar control when you have to bring it to your doctor in the clinic. Usually, we like to test the blood sugars right after they wake up, 2 hours after breakfast, 2 hours after lunch, 2 hours after dinner, and right before bed, right? And 2 hours after a meal, we usually aim for the blood sugar to be less than about 140 milligram per deciliter. It's very, very important to get as much data as you can in your blood sugar diary, because it would really help in adjusting your medication when you carry it in for your clinic doctor, especially if you are on insulin.
Right, so a very comprehensive definition on how to check to see if you are diabetic. Now, you shed a lot of light from the setting of medicine that you practice, which would be both inpatient and outpatient. Now, I practice more as an outpatient physician, being a family medicine doctor. You know, you're working in the clinic with all these old people, these old aunties and uncles who come into the clinic. And as you mentioned, they will take the medication when they come into the clinic because they know we're going to check the blood sugar. So they're trying to, quote unquote, fool the doctor. But I just always harass them and say, you know, we have a lie detector test here, and this lie detector test is what you said was the HbA1c. So now this HbA1c test tells us over the last 3 months how your blood sugar was. So you come on this day, the sugar good, but for the last 3 months the sugar wasn't good. This test will tell us whether or not the sugar is being controlled at home. Right? So a lot of patients, they feel, they only take the medication when they go into the clinic. The doctor will know, so I tell them, well, we would know because of the testing that we do. Now, you mentioned about the different values of this test. Now, we like this test in primary care, and they say anything less than 5.8 is normal. Between 5.8 and 5.3 is pre-diabetic or insulin resistance. Or as in the local terms, how people like to say, I have sugar, I have a trace of sugar. So this insulin resistance, this pre-diabetes is what we might hear people refer to as a trace of sugar. Now when we go on to the different steps of management, this pre-diabetic stage is also managed, but managed with lifestyle changes, which we will discuss a little further on. So knowing all of these tests, we would want to know, well, what symptoms a patient might have when they have diabetes. So Azim, tell us a bit about the symptoms that a diabetic patient may experience to know that, you know, they have something along these lines.
Of course. So they commonly experience excessive thirst, excessive urination. Some experience excessive hunger, weight loss, fatigue, blurry vision, and poor wound healing.
Right, so you mentioned all of these symptoms, and these symptoms are very non-specific, right? Meaning that, you know, a lot of people can have these symptoms, and when the patients ask me, I commonly say, well, you experience polyuria, polydipsia, and polyphagia, and they go watch me like, you know, this doctor, he ain't talking English, but he talking something else. So I am explaining to them that polyuria means an increased frequency of urination. Polydipsia means that you feel excessively thirsty, and polyphagia means that you're eating more than you're usually accustomed to eating. Now, it also have other symptoms like weight loss. Some people may experience weight gain as well. Some patients may feel tired, right? Now, all of these experiencing symptoms and all of these effects of a high blood sugar would definitely have an effect on your body. So, Azim, tell us a bit about the effect of diabetes on your body.
Of course. So, diabetes, the effect on the body, and this is absolutely widespread. So let's talk a little bit about how these effects come about in the first place. How exactly does an increased amount of sugar in the blood lead to all of these diseases? Now, increased amount of sugar in the blood over time, these the blood vessels, so we have arteries and veins. And the arteries is the one that supply our organs with fresh oxygenated blood. So this blood with high sugar in it is circulating through all of these arteries. And these arteries supply everything from the eyes, the heart, the lungs, the skin, the nerves, you know, the kidneys, everything. So we could see that this is going to affect those, right? Now, the high blood sugar actually, after, you know, sitting there for a long while, moving through the system, usually it damages the walls of those arteries, the walls of those blood vessels. And when those walls are damaged, it actually causes inflammation on the walls of the arteries. This inflammation actually makes the artery narrower, and it makes it quite easy for fat to be deposited on these arteries and these blood vessels, which further narrows and damages these blood vessels. So with that in mind, we just spoke about how these blood vessels supply virtually every part of the body. So when we talk about the complications of diabetes, we talk it in the smaller blood vessels and the bigger blood vessels. So the bigger blood vessels, these would be classified mainly as the brain and the heart. So we would know that diabetes is a major contributing factor to heart attacks and stroke. And this is exactly why the inflammation in the artery walls narrows it. And when blood supply is cut off from the brain, we get a stroke. When blood supply is cut off from the heart, different parts of the heart, we get a heart attack. So those are the main large vessel complications here of diabetes. But what about the small vessel complications? This as well is a huge burden on the patients. So one of the main things, the eyes, a lot of people, you know, they would know their grandparents, etc. They said that they have the diabetes, you know, caused them to become blind, or the diabetes caused cataract. So the smaller vessels in the eyes damaged by the diabetes causes visual impairment, diabetic eye disease. Another small vessel disease is what happens to the kidneys. So diabetes is one of the leading causes of kidney disease, chronic kidney disease, where kidney impairment happens slowly over time and may eventually reach to end-stage kidney disease, where the patient may need dialysis at this point, right? And now, something common that most people, most diabetics, especially in the old age experience, the damage to the nerves. Now, the nerves as well also has a blood supply. When the arteries are damaged and doesn't supply the nerve with blood, the same thing happens, the nerve dies. The thing about this is that it happens more on the peripheries of the body, especially down to the feet, right? So when these nerves die, the patient is actually unable to feel what is happening down there. So if they are walking in the yard and they step on a pebble, if they have a stone in their shoe, if they're walking and get cut by, let's say, a piece of galvanized or a piece of glass, they actually are unaware of this. In fact, because they're unable to feel this, a lot of patients end up with balance problems. And a lot of patients as well, after a while of not feeling these wounds get infected, right? And it takes a while for them to notice. A lot of times they notice when it starts to exude, pus, and then they reach to the doctor with this non-healing wound, only to realize that, they've checked the HbA1c and they've checked the blood sugar, and it's because of the uncontrolled diabetes, right? So these are some of the major complications of the smaller vessels and the larger vessels of diabetes.
Right, so a very comprehensive explanation of the pathophysiology, basically how diabetes affects and damages the body, with a comprehensive explanation on the endothelial damage. Now, the endothelial is the inner lining of the blood vessels, which is damaged by the excess sugars in the body, and then this will cause buildup of the cholesterol or the plaques and cause narrowing, and as you mentioned, it affects the bigger vessels and the smaller vessels. So that is why we have what we term as macro and microvascular complications of diabetes, with the macrovascular complications affecting the heart and the brain, where we get strokes and heart attacks, and the microvascular complications, a very detailed explanation of what affects a lot of people. If you go to the hospital, you would see people on certain wards in the hospital missing toes, missing legs, diabetes being one of the leading causes of amputations in the country, right? One of the leading causes of kidney failure. If you go to a room and you have 10 patients on dialysis, about 8 out of those 10 patients would have got chronic kidney disease and end-stage renal disease from being diabetic, right? So it has a lot of burden on our society, a lot of burden on our families, a lot of burden on the healthcare system. So we'll go to another break, and when we come back, we will discuss the management of diabetes. If you have diabetes, how do you get it under control? Is there a tablet you should take, or do you start with lifestyle changes first and then add the medication? When we come back, we'll discuss this.
It's time for mid-month savings at Southern Food Baskets. Fine Choice Calypso Pack, $15.95. Fine Choice Economy Pack, $31.95. Perdix Chicken Nuggets, 300 grams, $19.95. Crown Parboiled Rice, 8 kg, $69.95. Swiss Pasta Cuts, 300 grams, $4 for $19.95. No Name Toilet Paper, 2 pails for $89.95. Coca-Cola, Sprite, Schweppes 2 liter, 2 for $19.95. Richport Tuna Flakes in Water, 3 pack, $14.95. Diamond Foil, 25 feet, 2 for $19.95. Clorox 1 gallon, $31.95. Hurry in today and stock up for less at Southern Food Baskets, where big savings meet everyday value.
Enjoy Nice's family of fine foods, including our Jamaican-style patties. This complements Nice's range of premium chicken burger patties, lamb patties, beef hot dog, and our smoked beef and lamb sausages. Also, you can try Nice's halal gummy bears, available at leading supermarkets and at Nice's wholesale outlet. You can also shop for grocery and household items. Nice brand products, 23 Beocle Road, Conopia. Telephone 665-3078 or 665-3079. Nicer is nicer.
When the moment comes to honor a loved one, compassion, dignity, and faith matter most. Come to Shyams Islamic Funeral Services Limited. We provide trusted Islamic funeral and burial services grounded in tradition and handled with care. From ghusl and shrouding to transportation, janaza coordination, burial arrangements, and special international repatriation services of your loved ones. With professionalism, with respect, with heart. Shyams Islamic Funeral Services Limited, serving our community with honor.
Welcome back as we continue our discussion on diabetes. So as mentioned before the break, we're going to discuss a little bit about the management of diabetes. So our management here, we kind of focusing on type 2 diabetes because as we said, type 2 diabetes is one of the most common diabetes we have in Trinidad. But all of them have a similar management, but type 2 diabetes is what we'll focus on. And as mentioned before, type 2 diabetes is a lifestyle disease. So when we talk about lifestyle, what we talk about is the lifestyle in terms of the diet and exercise, right? So in Trinidad, we tend to have a very poor diet because we like very sugary stuff. We like soft drink, we like doubles, we like roti, we like rice. These things are packed full of sugars, as well as we like oily, fatty foods, right? Things that are fried, things that are very unhealthy to us. And now, as our society develops and a lot of technology develops, whereas long time we might have find children and even adults, going out and having physical activity, running the savannah, all of these things, we tend to lead a more sedentary lifestyle these days. So these things are contributing towards the increase in diabetes in our society. So we want to talk a little bit about the diet for a diabetic patient. What should they eat? What shouldn't they eat? Is there a specific way how to eat? Might be interesting to know that, right? So Dr. Nabi Azim, tell us a bit about the diet we should see in a diabetic patient.
Of course. So diet, very, very, very important, right? Actually, one of the first things that we tell patients who've been diagnosed with diabetes at any point, whether are newly diagnosed or whether diagnosis are uncontrolled later on in life, is that dietary modification is a must, as well as exercise. So let's talk a little bit about diet. Now, a lot of people, we give the old school advice. They would say, cut down on the sugar. Cut down on the sugar. Don't put so much sugar, don't eat so much sweets. Whilst that is good advice, there is actually a more comprehensive way on how to go about, managing diabetes with diet. So let's take this as some practical advice. We have a plate, a circular plate. Half of this plate should actually be leafy green vegetables, right? Whether it be your cabbage, your cucumber, broccoli, whatever leafy green vegetables that you have maybe growing in your garden, maybe you have it in the fridge, you bought it from the supermarket. Ideally, half of the plate should be leafy green vegetables, right? Now we move on to the other half. So that half, we're separating it into quarters. A quarter of that should be proteins. So whatever protein source you like, if you have some chicken, if you have some fish, if you have some beef, that should be a protein source. And then the last quarter should be your carbohydrates, right? And this is your rice, your potatoes, So this is how the diabetic plate should look. Now, there's actually a way to eat this and the order to eat this and a science behind it. So let's talk about the vegetables first. The vegetables should be eaten first, and the vegetables should actually be completed, eaten out first, before moving on. And let's talk about why that is. So the vegetables has a lot of fiber, cellulose. What this fiber does is it actually slows the absorption of sugar into the blood. So when we eat food, it goes to the stomach and then it passes on to the intestines, and the sugar is absorbed into the bloodstream. What this vegetables, leafy green veggies does is that it slows that absorption. How does this help diabetes? Because it stops a spiking of the sugar. Some people, once they eat food, the sugar spikes really, really, really high, over 200 sometimes, right? Having the vegetables first actually buffers this and helps to slowly release the sugars gently into the system. Then, right after that, we move on to the proteins. So we have the proteins. Proteins are very important in our diet, needed for many different things, muscle building, repairs, needed for many different things, right? We eat the proteins, and then we move to the carbohydrates. Now, there is actually a reason for this order, right? The first reason we spoke about before, which is that it would slow the absorption of sugars. The second thing is that after eating the vegetables and the protein, you would tend to be almost already satiated fully. And then you would be able to eat a smaller amount of carbohydrates. And as we know, the carbohydrates and the sugars, that is the one that we're most concerned about here in diabetes. So if you could finish the veggies and the protein first, you generally basically would have less space in the stomach and you wouldn't feel to eat as much carbs, yet you would have a full nutritious meal. So this is generally what we recommend for the diabetic diet.
Right, very interesting stuff there. Because, you know, a patient might think, well, would I eat my vegetable first? Would I eat the chicken first? You know, that shouldn't matter. You might think, well, you know, it doesn't matter. But interesting to know there is a method behind the order of how we should eat, right? I always find that very interesting. Now we move on to the exercise. So as I mentioned before, lifestyle diseases is about a poor diet, and we had some advice on how to eat. Now we need advice on how to exercise. So the WHO, the World Health Organization, recommends 150 minutes of moderate to high intensity exercise per week. So when you do the maths, it's about 25 to 30 minutes per day, right? It mightn't be too long. And I even tell my patients, you don't have to do it all at once. You mightn't have 30 minutes in a row, but you might have 15 minutes. So you start off exercising 15 minutes in the morning, 15 minutes in the evening, right? You want to do cardio exercises, you want to run, jog. And how you know that you're doing moderate to high intensity exercises? A very simple way is if you're doing exercises with this intensity, you will not be able to sing a song because you will be so slightly or even so extremely out of breath that you won't be able to sing a song. You may be able to say words and have, you know, say short sentences, but to sing, you won't have that long capacity because you'll be using it for the exercise. Now, the different types of exercises a diabetic patient might want to do as they get older especially, and as we mentioned before, sometimes diabetes may affect your nerves. You might want to do some balance exercises to help you with your balance, walking heel to toe, right? Then you might want to do some exercises that would help your coordination, right? You would want to do different stretching exercises to keep your muscles limber and moving well, right? So exercise, and another advice we give is do not exercise all at once. So if you're not accustomed exercising, do not go and exercise for the full 30 minutes from day one, because by the time you reach day 2, you'll be so exhausted, your muscles will be sore, you won't be able to do anything. So I say start with 5 to 10 minutes and slowly and gradually increase the amount of exercise you're doing so that your body would be able to tolerate it, so that you don't just shock your body and then you just stop exercising at all. Start slowly. You don't even need to go to the moderate to high intensity exercises to begin. You can start with low intensity and then build up to that slowly, right? So this is some advice about the exercise. We heard about the diet. Now, these are the lifestyle changes that we should make, and all diabetic patients, whichever type of diabetes you have, should implement these changes. Now, one of the other things we have is pharmacotherapy, which is drugs that we use to treat diabetes. Now, one of the most common drugs, and probably one of the most feared drugs when treating diabetes, is metformin. You know, people think metformin is this big monster. They are so afraid of it. Why? You ask the patient, doc, they will say, doc, I'm afraid of this thing. I hear metformin has caused kidney problem. Is that true? So I tell them, when a patient has kidney problems, we reduce the amount of metformin that they may give them, yes, but the metformin does not cause kidney problems. Metformin would help to control your sugar, and when you have a controlled sugar, you're less likely to get kidney problems. So it's more likely that metformin might prevent you from getting kidney problems than actually causing kidney problems. Now, there are other side effects of metformin. Prolonged use of metformin may deplete some of your B12 levels, so that's why we advise patients to supplement their B12 in their diet, as well as might take some vitamins to it, right? But other common side effects is GI side effects such as nausea, bloating, diarrhea, right? So we once had a patient, he comes to the clinic. He was having some of the symptoms of diabetes. He had excessive urination, and then he had excessive thirst. So as mentioned before, we send him for the HbA1c test, right? He was in the range of diabetes. It was over 6.3. So we started him on, one tablet of metformin twice for the day. But he was so fearful, and, he said, doc, I have a sister in America and I have one in England, and two of them had diabetes. I'm sure they're giving them something different. They will call them and find out what they're taking over there. So sure enough, I wrote the prescription. He did collect the medications. He came back within a month time to the clinic. So I say, so what you decide to do? You're taking the metformin or you're not taking it? He said, well, I taken it. Initially, I get a little bit of nausea, but my body got accustomed to it. So I said, well, how come you end up taking the metformin? And he was so afraid. He said both of his sisters, the one in America and the one in England, were put on metformin as the first line treatment, as well as lifestyle modification, as we discussed, for their diabetes. So, Dr. Nabi, I want to bring you a bit into the discussion here. Tell us a bit more about these different drugs that people fear so much, and the other classes of medication that you might use to treat diabetes.
Definitely. So, as we spoke about first, metformin. After diet and exercise, this is more than likely the first drug that your doctor would put you on, metformin. And metformin, what it basically does is it sort of sensitizes the body to its own insulin, to help remove the sugar from the blood. And as Taufik mentioned, some of the major side effects is things like nausea, vomiting, and diarrhea, which can discourage a lot of patients from using it. However, usually what we do is we lessen the dose to a point where the patient can tolerate it, and then once they can fully tolerate, we put it back up to the normal dose, right? So that is, Taufik covered metformin excellently. Another medicine that's very popular now with diabetes, and also especially with heart patients, is something called SGLT2 inhibitors. So this is just some letters that stands for the sodium glucose co-transporter. So how do these work? Usually in the kidneys, where the glucose is reabsorbed, this particular medicine acts on that part of the kidney. So what it does is that it stops glucose from entering back into the body, and it allows it to pass through in the urine. So basically you would have more passing of sugar in the urine and less in the blood. One thing we have to worry about with this particular medicine is, since a lot of sugar is passing there, we have to warn the patients about possible urinary tract infections. And so, hygiene as well, to keep the area clean and dry. Another type of medicine that we're now trying to move away from is a medicine called sulfonylureas, right? These medicines basically stimulate the pancreas to produce more insulin. But the major danger with this particular medication is the tendency of the patient to get a low blood sugar. So a lot of times, if the patient takes the medication, the sulfonylurea, and perhaps they have a busy lifestyle, they've forgotten to eat, or they're busy and they took their diabetic medication but they left for work and they don't eat, this medication a lot of times results in a low blood sugar, what we term hypoglycemia, low sugar in the blood. And this is if you're on this medication, it's very important that you can recognize the signs of a low blood sugar. So a lot of people, they report feeling anxiety, numbness, tingling, dizziness, feeling faint, sweating, heart racing, especially, in a diabetic or a sulfonylurea. These are some of the important things to look out for. Another type of medication, another type of newer medication out now is what they call GLP-1. It stands for glucagon-like peptide 1. Now, this particular medication is mainly used in diabetic patients who are obese, right, with a BMI of generally over 35. So how does this work? So it's actually injection into the fat of the belly, taken similarly to insulin. How does it work? It does a few things generally. So it stimulates the pancreas to release some insulin. It also slows the liver from releasing sugar into the blood. It slows the emptying of the stomach, right? So it slows the digestive process so that you feel full for longer periods of time. So in this way, you don't eat as much. And people also use these medications as it promotes weight loss as well. There is another type of medication called DPP-4 inhibitors. These basically just stop the breakdown of the GLP-1 in the body. So it promotes all of the effects we talked about before. It's delayed, slowed emptying of the food in the stomach, etc. And of course, those were the oral medications the popular oral medications. And of course, there is insulin. And many different types of insulin, different regimes for the morning and the evening, etc. So those are the general pharmacotherapy for diabetes.
All right. Comprehensive words there from our dear friend telling us about all the oral medications, and as of course everybody in Trinidad know about the dreaded insulin, but you shouldn't fear it much. If you reach to that stage, it is sometimes the only option. So we talk so much about diabetes, and the settings we talk about it is most times patient presenting to a clinic, patient as an outpatient. But is there any emergencies in diabetes, Azim? Would a patient ever need to be admitted urgently and emergently for anything that is associated with diabetes?
Excellent question, Taufik. Excellent question. And yes, there is diabetic emergencies. And one of the major diabetic emergencies that we see in hospitals frequently is an emergency called diabetic ketoacidosis. Now, a lot of people, we understand diabetes as, a disease where you go to the clinic, you get some medicine, you get treated, you test your sugar. But we should all be aware that uncontrolled diabetes can lead to life-threatening and sometimes, unfortunately, fatal diabetic emergencies. So this here, diabetic ketoacidosis, what exactly is it, right? So in the body, the body uses sugar for fuel, right? It uses the glucose for fuel. But remember, we said that in diabetics, this sugar can't be used. Why can't it be used? Because it remains in the blood and it doesn't get into the body's tissues and cells. So what does the body do? What does the body do now? Well, the body actually starts to use up its fat stores. So it breaks down the fat from the body. And when this fat breaks down, it throws something called fatty acids into the circulation, right? And then we have the formation of ketones, right? And so with this now, the body becomes very, very, very acidic, right? On top of that, with this acidity comes one of the biggest factors that causes this to be a diabetic emergency: dehydration. In diabetic ketoacidosis, dehydration is such a massive complication, and this is what we we try very, very aggressively to treat as an inpatient in the hospital. You know, cautious but continuous fluids to rehydrate this patient, because a lot of the times this sugar in the blood, this high sugar, sometimes the blood sugar is over 250, 300. You know, the blood has a lot of solute, it draws out all of the water from the cells, and the patient is very, 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 very dehydrated. So, you know, testing the sugar, having it more than 250, 300, and they can experience symptoms like nausea, vomiting, even leading straight up to coma, belly pain, you know, and the patient usually is very, very confused, very, very, very drowsy. So a lot of times if they're brought in without a relative, they are unable to tell you, you know, if they're diabetic, they're unable to give a good history. So, you know, it's up to the blood tests and early detection and a high index of suspicion for this particular diabetic emergency. So it's definitely something to be aware of, and it's definitely something that should encourage everyone, every diabetic patient, to properly manage their diabetes. And this is not exclusive to adults. Unfortunately, there's a high incidence of type 1 patients coming in with diabetic ketoacidosis in the pediatric population as well. So this is something to be very well aware about.
All right, very comprehensive words there, Azim. I would have seen this throughout my career. You know, as you go through these things, I'm thinking about the different stages in my career. When I was to work in the accident and emergency, we have this critically ill patient came in who, you know, the sugar so high the machine cannot read it. It would go to HI, the machine is actually say HI, and the machine not waving at you and telling you hello. It actually telling the patient sugar is so high the machine is incapable of reading. Know why it is? Patient's extremely sick, you know, and we start all the different therapies. We have to, you know, do different blood tests, and critically ill, so critically ill, some of them are admitted to the ICU and the HDU, where I also work, and so some of these patients critically ill. And then when they get a little better, they get discharged to the ward, and they will go to the internal medicine ward, again where I work. So this description you give me a lot of flashback to my, you know, my days over my career, how critically ill these patients can become with diabetes. Even in my general surgery days, unfortunately, we would have to scrub in on all these amputations, and for some reason these amputations are done after midnight. You know, you're sleepy and you're there, and you had to be sore. You know, we had this person born. I can remember one story when I was a medical student. I was called to the theater to help in a surgery, and it was just around lunchtime, and I didn't get to eat my lunch. I was about to eat lunch, and they say they want the male medical student to come. We have a diabetic patient, they're going to do an amputation on their foot. And the surgeon handed me this saw, and he said, she said to me, she said, well, this is what I'm bringing here. It's so big, you have to cut this bone. So I cut in the bone, and the patient was under spinal anesthetic, so they were still conscious. He started to laugh at me. He said, well, doc, you eat lunch? And I was like, no, I was going to eat lunch and I come here to do this. So, you know, a little humor there. But I would really like to thank my dear friend, who is a very experienced physician, very educated, one of the brighter fellows when I was studying medicine, graduated honors, right? A very bright fella with such prestigious accolades, becoming a member of the Royal College of Physicians in Ireland. I'm so proud of him. So Azim, just tell us your final words today. What you want to leave, the message you want to leave the audience with.
I appreciate that, Taufik. I really appreciate it. You know, we go way back as friends in medical school, and we always help out each other. And so, you know, if anything that I can leave you with here is that diabetes is manageable, right? And managing diabetes not only for yourself, but for your families, especially, you know, if you have a wife and children, you know, manage this well so that you can be in the best of health to take care of your family and the best of health to live a comfortable and happy life.
Right, so very good words there from my dear friend Azim, saying to get screened, know your numbers as early as 35 or even before if you have a family history and you want to take control. And as you said, diabetes is a manageable disease. And always remember, your health is a favor from Allah, and you should never deny any of the favors of Allah. So with this in mind, we will see you next time. Assalamu alaikum. See you next time on Doctor in the House.
Welcome back. You're viewing The Right Fit, and we're talking about safety with members.
How to help them, right? So palliative care, we want the patient to live longer and the patient to live better, right? You know, that is the watchwords we like to talk about, right, Nadim?
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to this live show, the Da'wah show with Brother Mirza. For now, inshallah, we'll have some other hosts as we go along.
I am your host, Dr. Abdul Shahan Shari Qasim, and this program
Assalamu alaikum. IBN TV8 is hosting an Arabic art and calligraphy competition for all students 12 years and under. Students will be required to write, draw, paint the word Allah or the word Muhammad in Arabic script with appropriate color scheme, designs, patterns and background. This competition will close on Thursday the 9th of July 2026 inshallah. The maximum size for each piece should be 50 centimeters by 50 centimeters or 24 inches by 24 inches. The material you can use is canvas or cardboard, Bristol board, paint, markers, pencils, pens, crayons, anything that you desire.